Hello. All right, so today we're going to be talking about hyperglycemia. So just a quick overview on hyperglycemia. Basically, it's an abnormal high blood glucose level, blood sugar level in your body, normally seen among diabetic patients. So there are several causes to for getting hyperglycemia in a diabetic patient. So some of them include stressors, just being extra stressed, eating lousy, consuming more carbohydrates, forgetting to take your medication and or insulin, being ill, sick, or having some kind of infection is a stressor for the body, as well as not being as active or being completely inactive also. Some of the symptoms, as we went over before, so polyuria, polyphagia, polydipsia. So you seem to understand those pretty well. You got 100% on the accuracy on those, so good job. So some additional ones are fatigue, headaches, blurred vision, so just kind of extra information. So there are several different type of resources used for hyperglycemic patients. So I printed out this picture here to kind of help you and give you like a visual aid. So we're going to go over these. It really just depends on what your physician feels is necessary and how extreme or how how high or how low your numbers are. So we will first focus on the blood glucose meter. So this is a very safe and easy procedure. And very good to do if you're ever feeling odd or you're feeling any kind of the symptoms that we went over. So the way this works is a sample of blood, a drop of blood is collected onto these strips here. So you're going to use this lancet device here to prick your finger. I would switch around fingers, in between testing. So then the drop of blood goes onto the strip here, which will go into the blood glucose meter, and it'll read out your blood glucose number. It's usually pretty quick. Once that blood hits, usually 1 to 2 seconds after, depending on your machine, of course, but it doesn't take very long. So that's one thing. Again, use frequently. And depending on what your physician advises you, you may have to do it 1, 2, 3 times a day, so just depends. Next, we'll go to the insulin. So this is also just helps balance your blood sugar level and keeps them at a normal range. You'll see this in like a syringe type of thing, as shown in the picture, an injection pen, or there's also insulin pumps, which is like a continuous insulin pump, basically, or a continuous flow, I'm sorry. So insulin is usually inserted into the abdomen. It's inserted into the outer part of your arm. It can be inserted in the buttocks. It can be used on your thigh, so front or side thigh, your hip. So many different places. And definitely one important thing is to rotate the sites as you're injecting yourself, just to avoid any swelling, any lumps, or any hardening skin. All right. There are different types of insulin, not really important for you to know because your physician will be the one to prescribe, which one you need. But just to go over it, there are rapid acting, short acting, intermediate, and long acting. The difference between them is how quick they work and how long they work for and their peak times. So other than the insulin and then the glucose meter, we have oral medications. One of the most common oral medications given is metformin. Again, depending on your severity, you may take 1 or 2 pills a day, higher, lower doses. This also works by lowering your blood glucose levels and decreasing the amount of glucose produced by the liver. So all fairly work the same way. So one good resource for you to take home from all of this is I would strongly advise going to American Diabetes Association. It's www.diabetes.org, and I will write it up and so you guys can be more familiar with it. And go to the Living with Diabetes tab and then the medication tab, and it'll go over everything that we've gone over here. So just to, if you need more information. as well as great diabetes information. So next it's your turn. Tell me what each of these do and how they work. So go ahead. Perfect. You got 100% passing rate. Thank you.